Are you thinking about combining cosmetic procedures? Let's first talk about some accounting. Firstly, we have to remember always that cosmetic surgery is elective surgery. And so we have to always balance our risk to reward ledger. And that's where the accounting comes in. In the positive ledger, we have the perceived or anticipated cosmetic outcome. And for different patients, that will have different levels of benefit. However, since it's cosmetic, it's not quite the same as, for instance, removing a cancer, right? That would have even higher benefit. So we have to know that we're starting off with maybe a little less benefit than removing a cancer. And that means that a lower positive ledger has to be balanced out by an also lower negative ledger. So what's in the negative ledger? In the negative ledger, we have both risk from the patient and risk from the surgery or surgeries that you might combine. When we combine surgical procedures, we are inherently increasing the risk, whether that's just theoretical, marginal, or even just difficult to quantify. This is because we are creating additional injury either in the same area or an additional body area. And by definition, we're also increasing the operative time. And both of these issues can increase the risk for complications. Now, the other aspect on the negative ledger is patients themselves come with inherent risks. These include issues that are specific to the patient's medical history, current history as far as chronic illnesses like diabetes, and a family history can also contribute to risk of complications. This is why it's practically impossible to give universal recommendations for what procedures to combine, when, and for whom. That's why it's so critical to visit with a plastic surgeon who's willing to spend the time to review this information with you and go over the decision-making process on when to combine what procedures specifically for you, understanding that it's a safety issue. And if these issues aren't being discussed with you, it doesn't mean that the decisions aren't being made for you. So if you have any additional questions, feel free to leave a comment below or reach out to us and schedule a consultation. Be happy to chat with you.